So today we'll be discussing burn injuries causing alopecia or hair loss, requiring surgical hair restoration. We will first discuss the case of a young teenager girl in whom surgical hair restoration was done. Now, this girl, who's 19 years old, came to us with a history of scalding injury. Hair loss due to burns significantly impacts the burn survivor. Burns alopecia is not only a physical injury, but is an emotional, a psychological, and a social injury as well. It has tremendous psychological impact, and since social stigma is attached, people who have suffered these injuries often come seeking a surgical hair restoration. Now, in this 19-year-old girl, she sustained in early childhood a scalding injury when piping hot milk fell on her head and caused burns to the left temporal region. Unlike other indications for hair transplant, where hair transplant is a cosmetic procedure, where hair transplant is a luxury, so to say, in burns hair restoration, this is an essential emergency because it significantly affects the patient's psychology and it also mitigates the social acceptance of the individual. So this is the importance of surgical hair restoration in burn survivors. So this young lady who is in her late teens and early adulthood, studying in a professional college, has a whole life ahead of her. And so she had till now been combing her hair in such a way as to camouflage the burn area. It does restrict all the hairstyles and it is always in her mind and it looks as if she's obsessed in keeping her hair in place. So she came to us and we planned a 2-session procedure. First, a test session was done, and once the test session succeeded, a lower density, 20 grafts per centimeter square density plantation was done, and a repeat hair transplant procedure followed after 6 months once these hair had grown. And this is the result, as you see on the pictures, after a complete 1 year had passed since the first hair restoration procedure. So the patient is now very happy, very confident, her self-image has significantly improved, and she no longer has the psychological trauma associated with the burn injury. So this is the amount of psychological relief that is obtained by a burn survivor through an aesthetic surgery procedure, which in this case should not be seen as a cosmetic procedure, but as a functional procedure because it affects the psychology of a person and social acceptance of the person. So now a little bit of the history of hair transplant vis-a-vis burn injuries. Now, hair transplant, surprisingly, many people do not know, is a byproduct of war. Hair transplant was discovered by military surgeons of the Japanese army while treating trench injuries, burn injuries, gunshot injuries of the face, while restoring the hairlines and restoring the scalps which had sustained burn alopecia. So it was Okuda, a Japanese reconstructive plastic surgeon, who first attempted hair transplant in burn survivors for their hairlines, for their eyebrows, for their eyelashes. And he met with success and he published a few papers which are widely acclaimed as the forerunners of the science and art of hair transplant surgery today. The art of hair transplant did not reach the Western world till 10 years after the hair transplant procedure was discovered by Okuda because of Second World War. It was only after the Second World War that the Western world became aware of the possibilities of hair transplant. Slowly and surely, hair transplant found a place in androgenetic alopecia or baldness. So the history of hair transplant started in an East Asian country, and that too as a byproduct of war, invented by military surgeons of the Japanese army. I have the honor of having served the Indian Army as a plastic surgeon in my initial years, and we have been doing a lot of burn surgeries, a lot of burn cosmetic surgeries, a lot of burn hair transplant procedure. Though for the last about 12 to 15 years, I'm not in touch with plastic surgery at all, but books about restoration of burns patients, of trauma patients still adorn my library and this bookshelf behind me. So these are some of the books that I read while I was practicing the art of surgical hair restoration in burns. And while in the army, we published a series of 50 patients in an Armed Forces Medical Research Council paper, 50 patients of burns whose facial burn injuries were restored using surgical hair restoration. So burns can happen due to thermal injuries, Burns can happen due to chemical injuries, burns can happen due to radiation injuries, and burns can happen due to electric injuries. But the most common cause of burns is thermal injuries, which can be scalding injuries or due to dry heat. The severity of burn dictates whether hair transplant can be done on a particular patient or not. Deep burns obviously burn the whole skin, and it is common sense that grafts will not take on split skin grafts or on exposed surfaces. Stimulation of the burnt hair follicle does not produce any result. Things like lasers, things like PRP, finasteride, minoxidil will not help burn alopecia. So in burn alopecia, the patient's suffering is alleviated only through either hair transplant if the patient is fit for a hair transplant procedure, reconstructive procedures like full thickness skin grafts, serial excisions, flap covers that are expanded flap covers using tissue expanders. So what are the factors which influence the eligibility of a hair transplant for a patient? Number one is the severity of burns. Deep burns that are scarred and are not covered by full thickness skin, by FTSG grafts or by flaps, will not accept hair grafts. Number two, the size of the burn. If the size of the burn is such that it is very large, usually more than 150 to 200 square centimeter, and it far outstrips the availability of the scalp donor to fill this burnt alopecia area with adequate number of grafts to create the illusion of fullness, will not be in the patient's interest to go in for a hair transplant. And this is especially so in females. In females, the donor area is restricted. In females, body hair grafts are not available. Burn area involves the donor area as well. It is very difficult, rather well nigh impossible, to do a hair transplant procedure on a burn survivor. In such cases, other procedures like expanded flaps or serial excisions or just flap procedures are of greater utility, and saving the hair transplant for small areas along the hairline, for eyebrows, for eyelashes, mustache areas and beard areas. So these are the restrictions of hair restoration surgery in burn survivors. Thirdly, what is the type of scar tissue? If the scar is not matured, if the scar is not flat, if the scar is not too thick, if the scar is not hypertrophied, if the scar is not having keloid tissue, and if the scar is not supple enough, hair transplant is ruled out. Usually a scar matures and becomes supple over a period of 18 months to 24 months. As it is, till this period of time, that is till 1.5 years to 2 years, hair transplant in a burn scar is not advisable because the scar is undergoing a period of scar modulation or scar maturation, and these scars will not accept hair. The scar tissue should be pale. It should not be pink. And lastly, the size of the scalp donor. Because it is the patient's own hair which will be transplanted to cover the bald areas in burns. So that has to be adequate enough, of adequate size, having adequate amount of donor hair, permanent donor hair in the safe zone for the patient to be eligible for a hair transplant procedure. But every patient of burns is not a candidate for surgical hair restoration. So what are the other modalities of treatment that can be used either singularly or in combination with few number of grafts in such patients? So these can be adhesive hair bearing prostheses which are available in the market, hair replacement systems which are a newer form of wigs of yesteryears. We also have scalp micropigmentation which is available, and then cosmetic camouflage, sprays and camouflaging dyes and colors which are available like dermapatch and hair fibers. These systems can be either used alone or in combination with grafts, howsoever small, that are available, to give a near complete full look to the patient. All burn survivors having burn alopecia are not candidates for a hair transplant. There are other treatments which can be used as adjuncts to hair transplant, which can be assimilated in the treatment in a holistic approach towards managing these challenging cases. Thirdly, hair transplant in burn survivors has to be a staged procedure. Overloading the scars with high densities may not allow all the grafts to survive, and by the all or none phenomenon, all the grafts may fail. So therefore, densities more than 10 to 12 grafts per centimeter square should not be done in one session. After 6 months of the first procedure, further addition of density up to 45 centimeter per square can be attempted. A burn alopecia candidate, when properly chosen for a surgical hair restoration, gives very good results and is more satisfying to the operating surgeon than a regular androgenetic alopecia patient's result would be. And of course, it does so much good to the self-esteem, the self-confidence, and the social stigma that the burn survivor is experiencing, and the amount of gratitude the patient with burn injury has towards the hair restoration surgeon is far in excess of that of an androgenetic alopecia patient. So personally, I get a lot of satisfaction doing hair restoration surgery in burn survivors. Thank you for watching. If you have any comment, please fill up the comment box below. And thank you for watching my video. God bless.